Hey everybody, I was just coming on to talk about the results of my CT scan. Dr. Cho actually called me yesterday afternoon, and he told me that everything looked normal as far as I don't have any kind of infection or anything like that, which we all had talked about that apparently there have been no infections going on. It's just been like a lot of congestion and stuff, which is also caused by the collapse in my nose and the holes that are in there where when I drink, you know, the liquid goes up in my nose. Well, and today it's a lot worse today. And I didn't do my navage this morning. But anyway, so he called me and we talked, and he said that the radiology, people reading the CT did not say anything regarding, the holes, but you can. He said he was looking, but he was, he knew they were there, but he was also, so he was looking and said that he could see, that there was a pocket, two pockets there or whatever, and that, he was like, I just wanted to, I know you're not crazy, I saw it, you've seen it, but what he wants to do is to wait to see if going in with Dr. Cox is going to go in, and fix the collapse and, take cartilage from my ear, fix the collapse. And he wants to see me like several weeks after, within recovery time, and see if that has actually helped with like the congestion and things like that. Because the thing is, if I'm remembering correctly, since I had surgery, I could feel, when I drank, I could feel, that in there, but while it would feel cold, it never, I guess, bothered me. Now it bothers me because it's congested in there, and it's like it just sits there, and my nose is just so dry, and by that, and this is disgusting, I'm sorry, but this is part of it. It's not dry in the sense of flaky dry. You know what I'm saying? It's like thick white mucus that is, it's dehydrated, so it's thick, and it's, it's not. I've just now gotten to where I can actually blow my nose. It's the, the crap we talk about on here, but this part of it. I mean, my journey with cancer, the reconstruction, removal and reconstruction of my face. But anyway, and so he wants to see me and see if that has gotten better, but also, of course, because this is just, he's like, I am just in awe about this. I want to write a medical paper on you. Of course, I won't mention your name. I'm like, hell, you can mention my name. I'm like, I said, there are doctors in Mississippi and another eye doctor that said they wanted to do a paper or a book on me. I'm like, and I told them they could use my name. I don't care. It's things happen to me that don't happen to other people, or things come up. But one thing is, that was just funny. Because it's like, if somebody had told me all the crap that I'm telling you guys and that I tell people that literally happens to me, like bump, 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 back to back to back to back to back crap, I'd be like, she is exaggerating and she is so full of shit, But I'm not. I'm actually not telling y'all everything. So that's the whole thing. But I can see where that would, just so many things cannot happen to one person, but they can. So I'm here to tell you. And that's just the way it's always been. I don't know why. Like I say, I'd just rather be plain old Jennifer, nothing special, nothing, weird, Abby normal, whatever, but that's just not how it is. So, and I can say it has definitely. Spoke to my counselor a couple of days ago, and that's like I told her. I said, I'm exhausted. I'm mentally. I say that a lot on here. Of course, diabetics, y'all know, we're always exhausted. Like I did not sleep last night. I slept from 12 to 2:30, and I didn't sleep well. And so I've been up since 2:30. And yeah, I know I've got makeup on and my hair's kind of done. You know what I'm saying? But I did that for my husband. I mean, and it makes you feel better to get up and do that. If you always look like shit, I mean, you're never going to feel better. I always say that. You don't have to do that all the time, but it is nice to get up, even if you're not going anywhere, and, put your face on, put your war paint on. And that's what I call it, my war paint, because God knows I have to fight to get up in the morning and do anything. I just heard my G6 go off because the receiver's way in there. So hold on a second, I gotta go get it. Okay, I got it. It was beeping because I lost signal. And that's another thing. I know I was talking about putting war paint on and getting up and fighting or whatever, but it kept going off last night. That's what actually woke me up, and I had it on vibrate. So when you use the actual receiver, you can actually put it on vibrate. Now, if it goes to like a critical high or a critical low, it'll take it off vibrate and scream at you. But that's a good thing and a bad thing, that you can kind of put it on vibrate or mute it or whatever, you know what I'm saying? Because, and that's what, again, I've said this before, so I tell my husband, I'm like, I know it's aggravating. I said, but you don't want me to get up and go sleep somewhere else. I'm like, that's your thing. I mean, I hate it. I don't want to not sleep in the bed with my husband. But again, he's the provider, and if he's not getting good sleep, but the fact is that sucker, because of military, he can literally sleep through infantry fire. I'm not joking. I mean, tornado, somebody shooting directly at him. I mean, I'm not joking. And I just want to take my pillow and smother him with it, because I'm so mad that I'm jealous that he can go to sleep like that. Because well, now I can. I mean, of course, I have to take something to sleep, but even then, I'm still, I still don't sleep well. I think I pulled something in my hip somehow yesterday. I don't know how. So I'm fisting Advil and that kind of stuff. And of course, like that has aggravated my blood sugars, but I couldn't get them down. And it's like, it was 280, and it would go up 290 something, and then it would go back to 280. And I mean, I just kept having to do that, and it still wouldn't come down. And finally at 6 this morning, my husband got up. Of course, he was mad. Why do you get up? Don't get out of the bed, blah, 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 blah. Anyway, and, which is sweet. I mean, but, and they just come down. Well, then, of course, I'm like, what the hell's going on? I felt like I've never had the flu, but that's what I told my husband earlier. I was like, if I can imagine what the flu feels like, this morning is what I could imagine the flu felt like, because my whole body was hurting. I mean, my blood sugars were just uncontrollable, weirding out. I'm changing all the basal rates and all that kind of stuff. And then it's the time of the month, and that's why. But it's mine are bad, and that's when my blood sugars go. I mean, like 600, 700, whatever. I mean, that's just how it goes. And some people are like, you're going through menopause. I'm like, it's always been that way. I begged for and actually I was supposed to have a hysterectomy before, because they had found a thickness in the lining of my uterus or whatever, and of course they did. And so they suggested that I go on and get a hysterectomy, which I don't know why. They didn't want me to have my son, and they said that they would not give the go-ahead at all for me to have another child at all, that I was blessed and they were correct, with the grace of God, that, nothing horrible happened to he or me. Um, but so I don't know why they said because I was so young, and they kept saying that you're childbearing age. I'm like, but you don't want me having more kids. I'm like, take this out, like rip that shit out. I'm like, all it does is cause me pain, and I'm constantly sick, because of it. Damn Eve, I'm stupid Adam. That right there is why I don't eat apples. Anyway, but anyway, so that's why, and I was changing all my Basal-Rates and stuff like that, but none of the 5 now Basal-Rates that I have is working right now. So I'm gonna have to go in and do it because it only lets you have 4. So I've got to do another temporary Basal-Rate that I can just pop in there, and do it because it only lets you store like 4 Basal-Rates, and then you can do temporary Basal-Rates that you can save in the Omnipod. And of course, nobody ever calls. Telemarketer. Anyway, so that's why they've been haywire. But anyway, and so I'm on no sleep and just ugh. But anyway, Dr. Cho wants to write a whatever on me, and I told him that was fine. But that's what he wants to do, is to wait and see if Dr. Cox, when he fixes all this and and all that it will possibly open it up enough to keep it from being congested, so this won't be an issue. But this is what I was going to say, was that it also could be cleft palate. And that sounds weird, but there are different levels of severities of cleft palate, and this could also be that. And so that's another thing to possibly consider, and I mean, if he said if I could live with it, there'd be nothing to worry about. But the whole thing is, can you live with a constant feeling of a runny nose and congestion, and it's miserable, really, seriously. I mean, for the most part, I like to be sarcastic, and I am. I mean, I try to have a good attitude, but it is miserable. And if any of you, I want to validate your feelings. If any of you are having similar problems or whatever, sometimes people do not validate us, or they try to be kind by lying, and I cannot stand that shit. I can't stand a liar. I cannot stand it, regardless if you're trying to save my feelings or not. Little white lies like, no, I didn't get you that for Christmas. Things like that. But like me saying my hair's falling out, and people saying, no, it's not. I can see this falling out. Which, that was something else I was going to tell y'all. Plot twist. I had bought this kind of stuff. This is Magic Root Precision by L'Oreal. Okay. Anyway, and you pull it out and it's color, and you do like this. Well, the thing about this is it makes your hair kind of feel like, I can't use, dry shampoo. It makes your hair feel horrible. And it still looks like crap. But, so, I was using that, but it just makes it, gross. So, I just use, you can use eyeshadow, but, and I love this Sigma 3D HD Precision Brush. I use it on my face too, but I also, because of the way it is, I will dip, clean it off, dip it in my, this is e.l.f. Shadow Brow and Liner Palette. But I use this, and I will dip it like, in what's most relevant to my hair color, and that's what I have done in here to cover up. Because all this right here is just skin up in here. So yeah, so, and this brush, y'all, it is amazing. Look at how it's how it comes to a peak, but it's flat. It's great for tons of stuff, like contouring, all kind of stuff. Putting crap in your hair, but you can use eyeshadow, and it doesn't like, you know, if you don't want to have to wash your hair every day, it doesn't make it all gross like this stuff does. But I also got this. This is from Color Wow. Color Wow, you see? And this is like blonde. That's like a blonder blonde. And then this is a more like a muted blonde. And if I feel like this is just, you know, I mean, I do my own hair, do shadow root, bleach, whatever, bleach and all that. But if I feel like some days I'll get up, part of my hair a certain way, and I feel like it needs a little light, you know, it's too dark or something, because I just like to have a root, I'll go in with this brush. Y'all didn't know that y'all were going to like 4 for 1 today, did y'all? This info about different crap you probably didn't even care about. But there. And I was trying to think of anything else. Too, I wanted to just show y'all again, if you have like any scars or anything like that, you know, this lanolin balm. That's that. I got it at Walmart. Here is this. I got this. Actually, it's called Invisible Scar. Invisible Scars. I've shown it before, but I thought I would show it again. I got that on Amazon. And oh, this is another lanolin. It's supposed to be cream, but it's a damn balm. Yuck. I wanted a cream. I can't find any cream. So, and this is fantastic, people. Okay, this is Mederma oil. You can tell it's ate up because I used the crap out of it. But it lasts a long time. Like since this whole ordeal, I've been using it. Doesn't take a lot at all. Now this is the Mederma Advanced Scar